and welcome back to another episode of We Spark. On tonight's episode, we have special guests Kenan and Sira. They will be talking about their project, It's Just a Vape. So, why did you decide to cover this topic?
The idea behind vaping was to get current smokers who are addicted to cigarettes to use a less harmful alternative. Unfortunately, due to inappropriate advertisement and improper marketing strategies, the majority of current vape users are first-time smokers and the demographic is dominated by teenagers. This is why we wanted to create a project that highlights some of the adverse health effects of vaping. We also wanted to demonstrate how the smoking culture that was apparent when cigarettes were popular has revived due to vaping.
That's amazing. I'm sure many parents were happy. So how did you implement your project?
That's a great question, Dr. Porter. Allow me to explain. We decided to make an animated video that goes through the history of smoking and its correlation with lung cancer. We then highlighted the emergence of vaping and touched on some of the known adverse health effects as well as its potential link to lung cancer. We would love to play a snippet of the video for your viewers.
Absolutely. Adriana, can we roll the clip, please?
In March of 2020, multiple case studies report severe injury from vapes, including acute nicotine poisoning, seizures, alveolar hemorrhage, multiple different pneumonias, and severe asthma. Serious vaping-associated pulmonary disease cases rise to more than 2,000. A European Respiratory Society task force concluded that there is no evidence that vapes are safer than tobacco in the long term. Evidence of vape products increasing the risk of moving onto tobacco cigarettes continues to grow. In July, 13 hospitalized adolescents, around 15.9 years old, with confirmed or potential electronic cigarette or vaping product use associated lung injury, or EVALI, were studied. EVALI is a term coined by the CDC after the outbreak of lung injuries associated with vaping. 69% of these patients presented with respiratory symptoms, whereas 85% presented with gastrointestinal symptoms. They all had bilateral ground glass opacities on CT scans, which indicate lung damage. Glucocorticoid treatment led to clinical improvements in 11 to 12 patients, while 4 patients required home oxygen. This is an image of ground glass opacities compared to a normal lung. Vape use amongst children needs special attention because of neurodevelopmental changes during adolescence, particularly vulnerability to substance abuse. Concern about long-term harm from vapes include endothelial damage, DNA damage, and oxidative stress from vape aerosols. Inhalation injury is also a concern given case reports of adverse effects on lung, including multiple different pneumonias and diffuse alveolar hemorrhage. Alveolar hemorrhage is bleeding in the lungs. This is a CT scan of a normal lung on the right and a lung with alveolar hemorrhage or bleeding on the left. In October, a 17-year-old boy with progressive respiratory failure presented with EVALI and laboratory evidence of an overactive immune system. Respiratory status improved before it plummeted and the patient was readmitted. His overactive immune system warranted investigation of bone marrow, which revealed histiocytes were phagocytosing or eating his red blood cells. He was started on steroids and pain and swelling relieving medication. Unfortunately, his respiratory failure worsened. He required mechanical ventilation and life support, resulting in multi-organ failure and eventually death.
Many public health organizations have stated that vapes are not any safer than cigarettes. In this example of EVALI, you could see that on the left we have the normal lungs, but on the right we have lungs that have excessive tissue damage due to vaping. A common example of EVALI is popcorn lungs. It's a type of bronchitis that's irreversible. It damages lungs' smallest airways, making breathing difficult and decreasing the oxygen flow throughout your body. This is what the bronchi should look like. Due to the constant vaping and consistent inflammation, the bronchi becomes very constricted, demonstrated in this image, limiting the amount of oxygen that your body can get. Another example is pneumonia, which is an infection that inflames the alveoli, the part of the lungs that exchange O2 for CO2. The alveoli may fill with fluid, pus, and mucus, preventing proper gas exchange. On the left, you can see a CT of healthy lungs. On the right is the CT scan of a 20-year-old with alveolar damage from vaping. In this image, you can see the tissue damage and inflammation as a result. This is a CT scan of a 19-year-old who vapes. They suffer from pneumonia, have ground glass opacities, and minor septum thickening. This is a scan of a 35-year-old with ground glass opacities and pneumonia. You can see the excessive damage they've caused to their lungs. And this is a scan of a 49-year-old with pneumonia. Their health improved once they stopped vaping. From these scans, you can see the excessive inflammation and tissue damage as a result of vaping. This excessive inflammation can cause damage to the DNA of the cells in your lungs. This DNA damage is how cancer cells begin to form, and inflammation is one of the drivers of tumor survival, growth, and progression. Carcinogens. It's been shown that vapes may contain carcinogens such as formaldehyde, ethylene glycol, acetaldehyde, cadmium, isoprene, lead, and N-nitrosonar nicotine. A carcinogen is a substance that can initiate the onset of cancer. These chemicals have been shown to cause cancer and birth defects in other instances. DNA damage. When some of these chemicals in vape aerosols interact with your cells, they can cause damage to your DNA. If these damages are happening too often and your body can't keep up with all the repairs it needs to do, this damaged DNA will replicate and cancer cells can arise.
Wow, that is absolutely horrifying. I can't believe vapes made it this far in the market.
Tell me about it.
I also heard that you conducted a survey. Did you find anything interesting in those results?
Well, I'm glad you asked. We did our survey prior to giving the presentation. This was done on students from grade 9 to 12. We had a great participation with 93 responses.
In the survey we conducted, we found that 75% of students have never vaped, while 18% have tried it once, and 4% vape occasionally, and 3% vape regularly. When asked about their smoking history, 89% indicated that they don't vape, 5% strictly vape, 3% smoke cigarettes and vape, and 3% used to vape and smoke cigarettes but don't anymore. We also asked the students how many people they know vape. 22% said that they know no one who vapes. 32% said that they know less than 5 people. 16% said that they know 5 to 10 people. And 30% know more than 10 people who vape.
We were also curious about how much research the students have done on vaping and found that most students had not done any research about vapes. The research that was done was very minimal. It was interesting to see that although most students did not do any research on vaping, most believed it is bad for your health and cancerous. 86% stated that they think vapes are harmful to health, while 9% were unsure, 4% thought it was neither good nor bad, and 1% thought it was good for health. Additionally, 75% of students agreed that vaping can cause cancer, while only 25% think it doesn't.
Of the students who buy vapes, 65% buy from local stores, while 35% buy from online and local stores. Unfortunately, we found that 47% do not get asked for ID by the clerk selling to them. This is a major contributor to the youth vaping epidemic.
Most of the students who vape prefer fruity flavors. This tells us that underage vaping may be decreased by complete removal of appealing flavors from the market.
From our research, we think stricter guidelines on selling and marketing vapes need to be implemented and constantly enforced to decrease vape use amongst the youth.
Additionally, it would be wise to limit the flavors in vapes available. It is important that we continue to educate students about the harmful effects of vaping that are not commonly known. Given this information, we hope the future scientists of CURES continue this research and update all the metrics as time progresses.
This is unbelievable. Those metrics are very interesting, and it's about time someone stepped up and did it. On behalf of everyone, I'd like to thank you.
It was our pleasure.
Well, I think that's all the time we have today. Thank you for coming in. Thank you for tuning in tonight's episode. And as always, I hope we sparked some curiosity in you tonight.